Okay, so I try to look at some anatomical reasons. All right, some anatomical reasons why some things actually happen. So for this one, we are looking at the appendicitis. So it's a long question, but the summary is what anatomical reasons for appendicitis pain, starting from umbilicus and progressing to the Mcburney's point. What's the anatomical reason for that? Okay, so the question is this: a young girl was rushed to a comprehensive health care with complaints of a crampy abdominal pain and nausea, like she was feeling to vomit. So when the attending medical officer asked her to indicate where the pain began, the patient encircled the umbilical area. Okay, so when asked where she now felt the pain, she pointed at the Mcburney's point. Of course, that's typical of what this thing. What do they call it? That's typical of appendix. So after further clinical examination, the doctor diagnosed acute appendicitis. So what anatomical reasons can you give for the pain starting around the umbilical region, then going to the Mcburney's point? So the reason is this, right? First of all, we give an overview. They said that progression of pain in the appendicitis from umbilicus to the Mcburney's point is due to what? The anatomical location and the inflammatory process of appendix. So for the anatomical basis, location of appendix now. Appendix is small, it's tube-like structure attached to the cecum, which is the beginning of what? Large intestine. It's located in the right lower quadrant of the abdomen. So initial pain at the umbilicus. So when the appendix becomes inflamed, the pain is often felt around the umbilicus, that's the belly button, because the visceral pain fibers from the appendix, they enter the spinal cord at the same level, okay, as the visceral nerves from the umbilicus. Do you understand? So it's kind of like a referral pain. Progression of pain now, inflammation and irritation. So as the inflammation progresses, the pain becomes more localized as the parietal peritoneum becomes irritated. So migration to the Mcburney's point. So the Mcburney's point is located 1/3 of the distance from the anterior iliac spine to the umbilicus. So this is a point where the appendix typically lies, So when the inflammation reaches this point, the pain becomes more intense and localized at the Mcburney's point. So clinical significance is this is a clinical sign where the patient experiences sharp pain upon deep inspiration when the pressure is applied at the Mcburney's point. So this indicates irritation of the parietal peritoneum overlying the inflamed appendix. So that's the reason why the pain will basically move from the umbilicus, right, progress to the Mcburney's point in appendicitis.